We want to introduce you to the relevant federal and state statutes and policies that affect children with mental health needs and child welfare, including some key terms and concepts. We want to explain the funding considerations that constrain practice, provide you with an introduction to federal and state government resources, and introduce you to some emerging best practices from the public child welfare sector. It's time to get to know Title IV, Part E of the Social Security Act. This is the act that authorizes foster care reimbursements to state, but is almost silent on the medical needs for children and youth in foster care and doesn't mention mental health at all. Okay, it's actually in Title 21, otherwise known as CHIP, Children's Health Insurance Program. Hey, where can I find those amazing Social Security titles? Well, they're at the web address in the lower right-hand corner, socialsecurity.gov. This is also where you can apply for federal benefits for your clients such as SSI, but not medical assistance. As part of the comprehensive children's mental health system established under Sections 245.487 to 245.488, the Commissioner of Human Services shall create and ensure a unified, accountable, comprehensive children's mental health service system that is consistent with the provision of public social services for children. That's the Minnesota Comprehensive Children's Mental Health Act. The Children's Therapeutic Services and Supports statute is where the law defines which clients or children have access to service, who delivers the service, and that's the practitioners and providers, and includes requirements for providers to have the ability, skills, and training, which means certification, to provide services, and qualifies which services are excluded. Remember, eligibility equals payment for services. And a determination of a client's eligibility to receive therapeutic services shall be determined based on a diagnostic assessment by a mental health professional. The voluntary placement statute requires the use of a voluntary placement agreement when placing a child for the sole purpose of gaining access to residential treatment services. So which agencies oversee these laws in Minnesota? DHS, or the Department of Human Services, county child welfare agencies, and residential treatment centers, contracted providers, schools, correction agencies like juvenile detention facilities or juvenile corrections facilities. Online resources including statutes, links, definitions, and policies can be found at www.dhs.state.mn.us. DHS has a children's mental health division because these laws, statutes, and policies are complicated. So we've already shared some, but here are a few terms you may come across. PMAP stands for Prepaid Medical Assistance Plan, which is an HMO for medical assistance or Minnesota Care clients. Medical assistance refers to Title 19 of the Social Security Act, also known as Medicaid. Minnesota Care is a state-subsidized insurance plan that also contains federal CHIP, or Children's Health Insurance Program. A voluntary placement is when a parent or legal guardian of a child enters into a legal agreement to place a child out of the home for services. And finally, residential care, children's mental health residential treatment services that are a 24-hour-a-day program under clinical supervision of a mental health professional and provided in a community setting other than an acute care hospital or regional treatment center. The Minnesota Association for Children's Mental Health was founded in 1989 and is recognized by families and professionals as the state's primary resource for children's mental health. The Minnesota Association for Children's Mental Health was founded in 1989. It's recognized as the state's primary resource for children's mental health. They train professionals and present research as evidence-based proven techniques that can be put directly into practice. They host an annual conference, produce a range of publications, and have a website, www.macmh.org. What about national resources for information, practice, and policy guidance for children's mental health? The Child Welfare Information Gateway collects data, informational resources, and best practices. The National Institute of Mental Health has great resources, that's NIM. And finally, Georgetown University's Center for Child and Human Development sponsors the National Technical Assistance Center for Children's Mental Health, or the TA Center. Child welfare and mental health, that sounds like a best practice to me. Funding is provided by the Children's Bureau of the Federal Administration on Children, Youth, and Families through a cooperative agreement with the Child, Adolescent, and Family Branch of the Federal Center for Mental Health Center. The TA Center's Child Welfare Initiative promotes collaboration across child welfare and mental health agencies to design interventions that are built on the values of family-driven, youth-guided, community-based, and cultural competence. Are there other best practices in children's mental health and child welfare I should know about? You bet! The Child's Law Center of Los Angeles Foster Youth Mental Health Initiative. Their goal is to help generate lasting change in the delivery of mental health services to foster youth. Another great program is Wraparound Oregon, which is a grassroots program, and they talk about a community-owned initiative to build a system of services and supports for multi-system children with complex mental health needs. They say that we believe the system of care should be youth-guided and family-driven, with the needs of the youth and family dictating the types and mixes of services provided. What a concept! If this sounds interesting to you and you want to get more involved in children's mental health and child welfare, the TA Center has a youth advocacy webinar series that you can register for. The first webinar is on Saturday, December 4th from 4 to 6 p.m. Eastern Standard Time. The state of Minnesota needs you. The Minnesota State Advisory Council on Mental Health Subcommittee on Children's Mental Health is currently seeking member applications. The State Advisory Council advises the governor, legislature, and state departments on policies, programs, and services affecting adults with mental illness and children with emotional disturbances. And it's also the state's planning council under federal law. So please feel free to go to www.mentalhealthcouncilsmn.com and submit your application. For more information on future directions in practice, policy, and research, see Continuing Dilemmas and Unresolved Issues by Anna.